No, because it's not paying much attention to that. ACTH has a small effect upon mineralocorticoid excretion. Okay, but you are going to have some daily doses of glucocorticoids, but what kind of dosage are you going to use? I'll say it as I've said before to other students, there's no such thing as a dosage range for any hormones. They give you a recommended range on the bottle, so you start at that. But it will vary with your reaction or response to it. And what your dosage is for any hormonal therapy is the lowest possible dose without clinical signs. So you may start up with the dose that's on the bottle, try to get them stabilized, then you try to decrease that dosage. So again, treating endocrine disorders is not a one-day thing. It's going to have to be over several weeks and sometimes months before you get the animal balanced and everything. Now, what do you think about iatrogenic Cushing? Just take them off the steroids you're giving? Because again, what has happened to the pituitary and the adrenal while you were giving that? It atrophied, so you take it off, and so what do you got then? Basically, you've got severe hypoadrenocorticism, right? So you've got to take them off gradually and hope that the pituitary and the adrenal will recover. Now, if they don't recover, then what you're going to have to do is keep that animal on that iatrogenic steroid therapy, but again, the lowest minimal dose possible where you don't see clinical signs. Everybody understand that? Everybody follow that? Okay. Now, if your clinical signs do reoccur with the iatrogenic things, then you're going to have to reevaluate the animal, or even if it's not iatrogenic, if it's just secondary and you've treated it, reevaluate the animal, and you may have to go through your whole course of therapy and everything again until we can balance them out again. Okay? Okay, now the recommended withdrawal regimen for iatrogenic Cushing's is to reduce the drug dosage is reduced to your physiological dose, which is usually about 0.25 milligrams per kilogram per day within the first week of withdrawal, and if you don't have clinical signs showing up. Okay? Now, if you still don't see the clinical signs on that, then you're going to, dosage is going to be reduced to every other day instead of every day. And again, you're hoping you're not going to see the clinical signs developing again. And after 2 weeks, if it's not seeing clinical signs coming back, you can give the drug maybe every 3 days. And after 2 to 3 weeks of this dosage, if you don't see clinical signs, then you can take them off entirely. But you're going to have to make sure that the owner is aware that if they get in a situation, they need to have steroids available, and you give them to them and tell them what dose to give to this animal. Okay? Okay, we have now let's talk about cats and dogs, right? Because what do you think we're most often going to see?
Cats and dogs.
If you got a cow that has an adrenal problem, what's generally going to be the fate of that cow? Will you see it, or will that cow probably be
Slaughtered?
Yeah, slaughtered. And the horses, it's not a common problem in horses, but it does occur. Okay? And one thing that occurs in a horse is called adrenal exhaustion in the equine. And what you're usually going to see is that the adrenal glands are a shock organ in the horse. Y'all had some about shock organs yet? You will in path, okay? But shock organs means that that's the organ that takes the brunt of the problem when the animal first goes into shock, okay? And so the adrenal in the horse that goes into shock can be damaged by hemorrhage and necrosis. And when you have necrosis, what do you replace that with usually? Fibrous tissue. And is fibrous tissue going to be much of a secretory thing there? No. And so you'll get this, if you have endotoxemia. What's endotoxemia? Usually bacteria, usually gram-negative bacteria in horses is very often either E. coli or salmonella. And you get bouts of that or severe colic. What's the most common thing that horses come into clinics for? Colic. Or anaphylaxis, drugs and stuff like that. And so basically that can cause, since the adrenal gland is a shock organ, that causes shock, and that's going to affect your adrenal very rapidly. Also, chronic administration of corticosteroids can do that, but we don't do that on race horses or anything like that, do we? We never give excessive steroids to any horse, do we? Right, you all believe that, huh? Okay. And also, what if it's a thoroughbred? Is getting out and running around that racetrack a nice everyday thing, or do they get really, like hyper stress and all that kind of thing? And you're doing that with greyhounds, race animals, okay? So then you take them off the track. Are they going to adjust very rapidly, or are they going to have some problems? And so that's why we have to watch out, because basically what you've done is you've exhausted that adrenal. Can overwork exhausted endocrine organ? Yes, and so it can basically damage that organ and replace by connective tissue again. So you have to be aware of that. But adrenal insufficiency should be considered in any horses that present with depression, weight loss, hyponatremia, hypochloremia, hyperkalemia, and also hypoglycemia. So when we say adrenal exhaustion, what category of hypoadrenocorticism are we talking about? Primary or secondary? It's primary, what we're saying with that, okay? And definitive diagnosis is a lack of an adequate cortisol response and ACTH stimulation test as far as the animals are concerned. In other words, for hypoadrenocorticism of any type, the first test is ACTH stimulation. Okay. Okay, let's take a break. Come back in 10 minutes and we'll pick up with this nice little hyper dog right here. Let me make sure you sign the first roll. Give that back to me.